Hello and welcome in. We have Dr. Barton Wood with Advanced Surgeons PC here at Grandview Medical Center, and we're talking today about obesity and medical treatment. So if you will, just start off by explaining, how do you measure obesity?
So obesity basically is defined as too much body fat, or commonly just being overweight. The problem with that is that different body sizes, different body shapes, it's hard to get a feel for someone considered obese, or how do we put them into a box of what's the right treatment. So we use something called the BMI, or the body mass index, and that's a ratio of height and weight that gives us a nice way to be allowed to figure out where somebody fits when it comes to their weight status. That allows us to know more about as far as the treatments they can be medically or surgically. Also allows us to look at things like their risk factors, which will speak differently as far as other health conditions, things like that. So basically what we're trying to do is allow us to be able to better judge on somebody's obesity level or not. A good example is someone who is 6'7", very muscular, athletic, can weigh a lot but not be obese. Someone who's 4'8", if they weigh the same amount, they could be morbidly obese.
Well, let's talk about the causes of obesity and, as you mentioned, some of the risk factors.
So, a lot of people, think that they may be obese just because they eat too much, or they have low self-control, so they can't stop eating, the right amount of food. We know that there are factors that are above and beyond that. Genetics is one. We have proven several things over years as far as hereditary, watching family trees, family trends, and we know that obesity is something that is a genetic component. There are environmental factors where you live. We know in the Deep South, we enjoy very heavy, rich, fatty foods. It's what we grow up eating. It's hard to avoid those as we get older because it's what we grew up with. So environmental factors and genetic factors. There are other factors such as endocrine, the thyroid. A lot of people think, my thyroid allows me to be fat, or it gets fat because of thyroid conditions, and other medical conditions that can lead to obesity.
Well, what are your thoughts when people ask you about the serious problems related to being morbidly obese?
So what we've learned through the years of being morbidly obese, and define morbidly obese, it's basically what we call on that BMI scale is a BMI over 30. 30 to 35 is kind of one category, then we go 35 to 40, and then above 40 and 50. To be in that morbidly obese category, there are a lot of other health risks that go involved. Common sense ones would be joint problems, back problems. The extra weight we're not designed to carry, so our knees give out, our backs give out. Things that maybe people don't think about, cancer. We've shown increased risk of colon cancer, breast cancer, many other cancers in obese patients, especially in morbidly obese patients. As far as high blood pressure, it's almost always a contributing factor. Most people who are morbidly obese will have hypertension. Acid reflux, sleep apnea, all these things go along with obesity. The majority of the things in obesity that are very bad, that obesity is a risk factor for, lead to heart disease, lead to stroke, the big problems. So someone who stays morbidly obese and doesn't get these things treated has a much higher incidence of heart attack and stroke, kidney failure. Those things lead to a very much increase in the mortality rate. And so what we find is morbidly obese people live a lot less long lives than people who aren't overweight. So it's a very serious medical condition. We do consider it a disease because of that process.
Well, we know that medical technologies are rapidly changing and always evolving. So if you will, share with us some trends in medical treatments when it comes to obesity and how you can help people. So medical weight loss is a multi-billion dollar, it may be even in the $50–60 billion industry a year in the United States. Every time you turn on the TV, especially daytime TV, you will see ads for try this and you'll lose weight. You've got the known brands that do a pretty good job. You've got medical weight loss centers all across the country where doctors will be involved, nurses, health professionals. But what we find is once you become morbidly obese, once your BMI approaches that 30–35 range, most of those things don't work. Short time you can lose 20 or 30 pounds. But because of hormones and things that change in our body when we lose weight, those things, once you stop, you will not only regain the weight, but your body will actually tell you to keep eating like you're starving until you've gained 20 or 30, maybe more pounds than you had before. That's the rebound that we see with these fad diets, is that people lose the weight,
they'll do great, then they'll put back on, and not only will they come back to even, they'll actually come back heavier in a year if they can't maintain the diets. They're also very expensive to stay on long term.
And what about surgical remedies?
So surgery begins being considered usually with around a BMI of 35. With a BMI of 35 and some of the other health risks we talked about, many insurance companies will cover the surgery. A BMI over 40, usually you don't have to have one of the other comorbidities, although most people do, so it's not really a factor. Surgical weight loss has been shown to be effective long term. And it's been more effective than other types of weight loss for the morbidly obese patient. There are a couple of types of surgeries that we here at Advanced Surgeons do. One's called the gastric bypass. That's more the traditional surgery. And then we have something called the gastric sleeve, which is the newer surgery, but now I can't really say it's new. It's been being done for several years now. We have good 5 and even 10-year data on that operation as well.
Are these done robotically?
Yeah. So the original trends on these surgery was open surgery, big incisions, a lot of morbidities, almost the fact that you had to really consider somebody's overall health in order to do it. When the laparoscopic or the camera surgery came out, it became much better operation. Very small incisions, patients were in the hospital just a day or two, the recovery was really quick. With the advance of new technology, the robotic surgery platform, the Da Vinci robot, now what we're finding is that because of better instruments, better visualization, we have better imaging of the things that we do, we just do a better job at. Therefore, much more people get the laparoscopic or robotic surgery than open. The complications rates, we believe, will come back lower once enough have been done and we can study it. The overall weight loss may be better because if we can see to do a better operation and make the pouches the right size or the sleeves the right length, then you may actually find that it is a better operation. For me, it's just an extended tool that allows me to do surgery better. I've done laparoscopic surgery for over 15 years. I've been doing robotic surgery for 5. It has been a huge change in that the technology is better. It's basically the iPhone over a flip phone, for a better term. The phone worked fine, but now we have a lot more things that we can do with that phone.
Well, what about recovery time? Because I know folks are watching this, they're really interested in, what is the downtime going to be like? What amount of pain am I going to be in, that kind of thing? So
the surgery done robotically or laparoscopically, there's usually either 5 or 6 small incisions, all less than about 1/2 inch to 1 inch. Those incisions are a little bit painful. Most people do require some narcotic just for a couple or 3 days. The majority of our patients come in the day of surgery. We keep all of our patients overnight, more so for nausea to watch for than for pain. And then if they're able to eat a little bit the next morning, they will go home by lunch the next day. And the majority of our patients do go home on that following post-op day. Afterwards, the majority of people, I would say, are probably back to normal activity at home within 4 to 5 days. And 2 weeks would be a long time to be off work. I think most patients probably at a week to 10 days are already back to their normal jobs.
Okay. So do you really work with patients, though, obviously getting them prepped before surgery and even after surgery?
So, what we believe in as far as an obesity surgery program is just that. So, as a surgeon, I'm a technician. I'm really, have trained and done a lot of the operations and things we need to do to get really proficient at performing a very good operation. However, we know that just doing a surgery alone does not cure weight loss problems. So at Advanced Surgeons, what we offer is a total program including a fitness coach, who is a personal trainer. We have our own dietitian in the office. She speaks to all the dietary issues. She will educate you before surgery, multiple times after surgery. If you're having issues, when you call the office, they will call you into her so that you're actually speaking to the expert in nutrition, not the surgeon when it comes to those issues. We have a nurse who does nothing but set patients up for their pre-op testing. She knows what tests the insurances and the hospital and the anesthesia will want so that there's not delays and there's not cancellations. And she is just all she does in her office is work with our bariatric population. She also is a source of emotional help and other issues that patients have when they call. So to be successful, you can't just have surgery and go home and lose weight. You need a team of people that are helping, and we follow our patients lifelong. We try to see our patients after the initial several visits at least once a year, so that if they are seeing a decrease or an increase in appetite or a little increase in weight, rather than waiting until they've gained 30, 40, 50 pounds, we can usually find a problem. Sometimes it's just re-education. Sometimes there's a surgical issue that needs to be addressed when someone gains weight, and we can closely monitor those for years.
If you were watching this and you feel like it's something that you would like to further explore, feel free to call the office here and schedule a consultation.